Hello, everybody, and thank you for your interest in the program. My name is Cathy Evans. I'm a physical therapist, and I'm also the graduate coordinator in the Department of Physical Therapy here. And I did my physical therapy training here in the 70s, I hate to say, and it has been a great career, so I'm happy to talk to you about it. Physical therapy is a profession that is self-regulated. We have controlled acts in our self-regulation. We communicate diagnosis. Soon we'll be ordering diagnostic tests like x-rays and some lab tests. And our profession is directed towards the prevention, diagnosis, and treatment of movement disorders, which covers a wide variety of diagnoses and conditions. We use exercise, we use electrical modalities like ultrasound, education, consultation to maximize function. And we're involved in let me see here. Although you'd start your program at 500 University Avenue, which is the university and Dundas, in a very nice building, and also have access to the buildings under the Faculty of Medicine, when you actually practice or go out on clinical internships, we cover a wide variety in the continuum of healthcare. So physiotherapists work in acute care and rehabilitation, long-term chronic care, private practice, and in sports venues. And as Dr. Kaplan said, one of the best things I think about coming to the University of Toronto, both when I did the program and currently, is the access you have to the incredible clinical facilities here in the Toronto area. And besides access to them, we have wonderful partnerships with them. The clinicians are really generous in terms of their teaching of clinicians at the internship level. What type of conditions do we treat? We treat musculoskeletal conditions, people with neurological conditions such as stroke or cardio arrest, they've had a heart attack, as well as people with more complex conditions such as diabetes and amputations. And more recently, I'd say there was a focus on health promotion, which is also an exciting opportunity for physiotherapists. So if you have a career in physio, you can work in both public and private settings. Most of our grads right now are working in private settings as patients get out of hospital earlier or are in for shorter stays. But you can still get a job in hospitals, especially if you are willing to take a contract position to start with. And when I look at this list of career possibilities in physiotherapy, I think that's why I've stayed in physiotherapy for so many years, and so many of my colleagues have, because there's so many things you can do. You don't have to be a clinician all your life unless you want to be. You can do other things. You can do research. We have a strong research component in our master's program, one of the best in the country in terms of the publications that we put out with our students. You can get into education. We work for school boards and health promotion, and you can also do consultation. We have a 100% employment rate. Many of the students who graduate want to work in both a hospital part-time and perhaps private practice so that they can see where their interests lie. And as you do internships throughout the program, sometimes people change their mind. A lot of people come in and they want to do sports, they want to treat ankles, and by the time they leave, they're more interested in treating neurological conditions. But the good thing is there are lots of jobs. You can work internationally. And I'd say the salary is a bit out of date here. It's more like $60,000 to $65,000 to start. To become a physio, you need a university degree, so you need an undergraduate degree. Then you come to a program such as ours at the University of Toronto, and then there's a national exam, and then you register with the College of Physiotherapists in the province that you're going to work at. Why study at U of T? I am biased because I came here and I teach, I came here for my training and I teach here. But I really like our teaching model, which is hybrid, I would say. We have a combination of lectures, case-based learning, and then authentic learning during internships. And you have access to amazing resources, one of the best online libraries in the world. And of course, the teaching facilities in the hospitals. As I said, we have one of the highest publication rates of student research papers in the country. and we have an exceptional clinical world where students can go. We take about 100 students per year. We get a lot of applicants, and so you have the ability to train with other students who are high achievers like yourselves. Right now the cutoff is 3.82. That changes every year depending on who is applying. We also look at your references. It's not GPA alone. And we look at a computer administered profile, so people do an online I'll call it a test, it's profile, and it's sort of situational based or behavioral based, how you would respond in, say, a situation of conflict. If you're interested in applying, the deadline is January 5th for schools in Ontario, and I'm not sure I'm going to be able to stay the whole time, but I'd like to invite you to come to 500 University Avenue on November 16th, when the School of Occupational Science and Occupational Therapy and the School of Physiotherapy will be having an information session, and you can tour around with students and see the building as well if you're interested. Thank you.